Today's video, I got a comment about a pet parent where their dog dislocated their hip, just straight out of the socket. Here's the comment. My 7-year-old lab, 42 kgs, had complete hip dislocation. He is able to walk, limping sometimes, but he has pain. Our vet suggested an FHO. We wanted to try closed reduction. Is this advisable? Alright guys, this is a tough one. In the human world, we think about if you dislocate something, the MD is going to pop it back in for you. They may do some surgery afterwards, but for the most part, they pop it back in, and from my understanding, you're pretty good. Here's the deal. With doggies, that's not the case, especially with the hip. Over the years, I've popped a handful of hips back in. I can only think of one case, and it wasn't even mine, where the hip actually stayed in. The thing is, once you pop a hip out on a doggy and you tear and pull all the connective tissue and muscles, the chance of it staying in is slim to none. There is also something called the ligament of the head of the femur, which is a ligament that attaches the head of the femur, the big bone, to the hip, into the hip socket. It literally attaches it. And when you dislocate the hip, everything tears out. So you're just kind of like dropping it back in and just saying, please stay in. And the minute the dog starts walking, it just kind of slides out again. I am always okay with trying. I will always try. I will always reduce the hip back in. I will try to stabilize the leg the best I can. My goal is to keep the doggy as normal as possible. Like, if we can pop the thing back in and the doggy can rest and be on pain meds and sedatives and we can stabilize the leg, let's see if we can keep that leg from moving for 8 to 12 weeks, and let's see if it can heal. The odds of that happening, not high. What we'll do is we will reduce the hip back into socket, and then we will send the doggy home on pain meds and sedatives to help relax him, and we will try to stabilize it with some kind of bandage or supportive wrap. Now, what's going to happen is we will set up a surgery time for them to come back in, probably the next week, for the FHO. With that being said, if the hip does not pop back out, we are not going to do an FHO, of course. An FHO, or femoral head osteectomy, is a salvage procedure. We do it on dogs that have displaced hips. Hip dysplasia is the most common reason. And what we do is you have the femur, which is the big bone that plugs into the hip, and we cut that off, and we cut the head of the femur off, and all the muscles form a false joint or a pseudo joint, and that allows them to still walk and do quite well. I've seen big dogs with 2 FHOs do pretty darn well. But remember, I said it was a salvage procedure. We should not be willy-nilly going in and just lopping off the head of the femur and doing FHOs on every dog before we give the dog a chance to heal. I've seen some amazing things over the years, and I believe animals can sometimes just do remarkable things healing. God made them very special. With that being said, we should always be planning to fix a problem. So a veterinarian should definitely schedule either a surgery or a specialist consultation. And if things don't become worse, if we don't dislocate it again, if we aren't limping, if we're resting, if we're doing good, of course, no one's going to do surgery, and we don't have to move forward to a specialist if we're doing well. It's all about good quality of life. And if it falls apart and the hip dislocates again, we're doing surgery. So I do expect this doggy here to need an FHO, and most likely, if done correctly, the dog will probably thrive and do quite well. And to the untrained eye, it will look like the dog is totally normal. No hip issues at all, walking around just fine. So talk to your veterinarian and really talk to them in depth about what the next step is. Making sure they always reduce it, and then talking about surgery. If they can't get it reduced, which happens sometimes, you are going to be doing surgery as soon as possible to relieve that pain. Because remember, the FHO, the goal is to get it so that it's no longer grinding on the capsule. So if you have hip dysplasia, guys, it grinds on the capsule on the hip, but if it's dislocated, it's sitting out here and it's grinding and it hurts even more. So we want to cut that femoral head off and then allow it to just sit down here right at the acetabulum so it can just float and be non-painful. The goal of an FHO is to restore function and reduce pain in the dog. Of course, It will not be a perfect leg, but we're looking to make the doggy happy, healthy, and comfortable. In these cases, guys, a veterinarian will prescribe things like an NSAID, like Rimadyl or carprofen. They will also recommend probably some codeine or something for pain. A lot of veterinarians may even give like some trazodone or something to relax the doggy so they're not as active and jumping around. Our goal is to control inflammation, pain, and rest this doggy. And guys, the good thing is most general practitioners can do an FHO. The femoral head osteectomy procedure is done by general practitioners all over the United States and all over the world. If you want to go see a specialist, they can do it too. And of course, don't forget, the total hip is out there. The total hip, holy cow. It's expensive. It makes me swallow. It's so expensive. I have to like cough it out. It's usually like $7,000 to $9,000 for a total hip, like a human would get. They are incredibly fancy, and they are next level with what it will do for your dog's joint health and mobility. They are just the Cadillac of a brand new hip. So if you can afford a total hip, that would be amazing. But in most cases, most general practitioners like myself will just do an FHO to fix the problem at hand and provide a better quality of life for that doggy that has the dislocated hip.